Hi, everyone. My name is Dr. Rita Roy, CEO at the National Spine Health Foundation, and I'm your host for the Get Back to It podcast, where we tell real stories of healing and recovery. What does it mean to get back to it? It means overcoming injury through treatments that work in order to return to the people and activities you love, whatever that looks like for you. It means getting back to your life. We're here to share the success stories of those who did just that. And some of these stories you're not going to believe. At the Get Back to It podcast, our goal is to tell stories of spinal champions, people who've been able to achieve a better quality of life through spinal healthcare. Today, I am thrilled to be speaking with Dr. Michael Perez, a general practitioner from Virginia, who had a successful spinal fusion surgery in his lower back. Dr. Perez initially experienced lower back pain while doing yoga, and after a year of pain, he decided to seek treatment. You'll have to keep listening to discover how this physician turned patient found the optimal treatment for him. Dr. Perez is a family physician who leads an active lifestyle. Some of his favorite activities include surfing, golf, and yoga. It was during a yoga session that Dr. Perez initially experienced his lower back pain.
I was actually doing some yoga classes here in our office, and I tried to do some positions in yoga and started experiencing a lot of pain. And I had a lot of problems getting out of bed, and my wife said, I think it's time to do something. So I needed to shift my active lifestyle.
Dr. Perez started his patient journey with non-surgical treatment. This ranged from physical therapy to injected methods of pain management.
I initially went to some physical therapy. I went to a friend of mine who was a chiropractor and tried even some injections, and things just weren't improving.
Dr. Perez saw a pain management specialist who suggested facet joint injections, but those only yielded minimal improvement.
Yeah, I went to the spine specialist and at the referral of some of my friends who are therapists and tried the injections, and they helped minimally. I was really hopeful. I was praying they were going to work, but they didn't work out too well.
Having tried multiple non-surgical options, including bone marrow injections into the injured disc, Dr. Perez began to explore surgical options.
Ultimately, a surgical solution was probably going to be the best for me, as I was just not improving. I had an unstable disc, and I went through with the L2-3 fusion a year ago.
Dr. Perez's fusion surgery was highly successful. 1 year later, he's been able to return to his favorite activities without medication. He attributes some of his quick success to having maintained a strong core pre-surgery.
Yeah, as a family doctor, I've taken care of lots of folks with back problems, and experiencing back pain for myself was really quite a whole new deal, and it gave me a whole lot more respect, understanding for those who suffer with chronic back problems.
Our physician turned patient shares some appropriate doctor insight.
I think the most important thing that I learned from all this was following the recommendations of the physicians and the providers that you're seeing. There's a path towards getting to a way of helping your back problems, and trying to follow those recommendations, especially the core strengthening, postures. Those are key ingredients to having successful outcome. And I feel like I'm proof that doing this is the way to go, and I'm very passionate about helping others.
Dr. Perez, it is so gratifying to see you living out the advice that I'm sure you are able to offer to your patients on a daily basis, now with even greater understanding. Lower back pain is always challenging, but I think it's especially challenging when you're living an active life that suddenly has to be paused. You shared about maintaining your strong core, which we're big proponents of sharing here at the foundation. And I'd say, what advice would you give to our listeners about maintaining that strong core, starting wherever they are?
I felt, for me at least, the strong core. I worked with doing a lot of yoga for the last 15 years, and I realized that having that foundation was good for lots of things, but especially for back problems. And so as I did my yoga, but then I couldn't do much yoga, I had to switch to more of a Pilates-based exercise to help strengthen that core. And as my core got strengthened better, I think it actually helped me recover from surgery better.
Yeah, that is such a key point. Oftentimes we hear the word prehabbing. So things that when you know you're headed, for surgery, often many surgeons will encourage their patients to do some activities preoperatively to sort of prepare their bodies to get strong so that the recovery can be a little quicker and a little better. And it sounds like you've been working on that for 15 years. So.
I was hoping that was going to keep me away from having to have surgery, but I think you're right. I think exactly that prehabbing was really a good idea, and I share that with my patients now to say, hey, if you can do this beforehand, you'll have a much better outcome and recovery.
Yeah. What is the expression that people use? They say the best exercise to do is the exercise you do. Right.
I like that.
And I think oftentimes people are intimidated and they say, I'm out of shape, I can't do this. And how do you see that with patients? Sometimes they don't know where to start and what should I do? And it's going to be such a long road. What do I do?
Sure. So, especially as a family doctor, because a lot of these folks I've known for a long time who then progress into needing such type of care. And so I have that relationship already built up. So I'm able to, and now even more so that I've had surgery, I can kind of share with them. And I do share with them, hey, this is what I've been through. This is what I found has helped me in my recovery. And so, having that conversation early on, not just sending them right to the surgeon and saying, hey, let's operate on this terrible situation, but getting them well educated and well informed, it takes away a lot of the worry and the concern so that they have a good outcome.
You got to the key point there with doing that education about what procedure is going to happen or about what treatment choices patients are making. The more you know and understand what is happening to your body, the better the outcome is going to be. And in fact, in spine, there are a number of studies called patient expectation studies, where scientists have looked at the conversation that happens preoperatively between the surgeon and the patient and making sure that they're on the same page. Because sometimes the surgeon will say, oh, I fixed it. We did a great job. But a patient might be expecting a different outcome or something different to happen. So getting educated, getting on the same page ultimately leads to better outcomes. We have data to prove that, but we sort of intuitively know that as well.
And I think one of the things that I tend to find is people do a lot of research on the internet about their problem, about the procedures. Sometimes they can find good information, sometimes they don't. And I have to kind of help them through that to realize, well, yes, these are options, but for your particular situation, you might need this particular type of arrangement with your physician, this type of procedure, this type of therapy, because it's not a one-size-fit-all thing here. So I think that it's important to be careful with internet information, but it's a decent beginning resource.
Yeah, and I would say along those lines, that's part of our mission here at the National Spine Health Foundation, is to be an authoritative, unbiased, honest, truthful source of information for people so that when they know that they're coming to spinehealth.org, they're going to hear really good information that they should then take to their doctor and discuss with their doctor. And I love that you said there's, no cookie cutter solution for neck and back or spine issues. What works for one person may not be the right solution for another person, but learning from others and understanding what the range of options are is important. And it's important for people to be able to discuss that with their doctor. Michael, you have mentioned that, it took you about a year to seek treatment. I'd like to talk about that treatment journey. One of the things that we try to educate people about is when it comes to your spine, don't delay treatment on that. So I liked hearing in your story that you felt this pain and you immediately began to sort of investigating, like something's wrong. I'm not able to get out of bed as quickly. I'm not able to do my activity. Something's wrong. Let me start looking into this. Can you talk to us about the choices you made? When did you know that physical therapy and maybe chiropractic wasn't getting you how do you know, like how long should a person let that happen?
Well, I can share my experience, and I might be able to shed some light on what's probably the best way to go about it. But I guess when I really couldn't do the things in yoga that I wanted to do, I was like, okay, this is not right. I can't play golf anymore. I had to stop playing golf. My wife liked to go surfing. I couldn't surf anymore. I was like, okay, and that took longer than I'd hoped for. It was probably about a 6 to 9 month situation before I really kind of kicked things into gear, because I was trying to do my own therapy, trying to do my own stuff, and it just wasn't improving. So once I kind of made that decision, went to the therapist, went to my chiropractor, did all these things, and it just wasn't going in a good direction. I talked to one of my colleagues, and he said, well, okay, you know what to do, right? You take the next step. So it took me a little push. I thought I could manage this on my own, but I wish I would have done something different a little sooner. But that's just the progress I had to make in my mind to come to accept that, hey, this is coming down to a surgery at some point in time. And I kind of had to just get the comfort with that. And even being a physician, I sometimes that's good, sometimes that's bad. And finally, though, when I decided to make that next leap, it felt right. I felt strong about it. I had a lot of support.
Yeah, that's fantastic. And with you being in healthcare, you have sort of an inside view on what that looks like. And I think, trying to manage the situation on your own, taking over the counter medications, trying to manage that pain, and realizing at some point, this isn't working. Let me seek help. I think that's such a key lesson to learn there. We like to remind people that, if you get to a place where you're feeling numbness or weakness, those are nerves talking to you, right? So bones can be fixed pretty easily. Nerves, not so much. So you don't want to let things go so long to the point of where there could be irreversible nerve damage. So.
Absolutely. And that was one of the things that was a little unique about my situation, was that I did not have any type of neuropathic symptoms. Mine was purely an unstable 2-3 disc. I never had any type of symptoms into my legs. I know that had that happened, I would have been on it much sooner. But I really felt that this was just something musculoskeletal that would get better on its own, or with what I was doing. But I remember the one morning getting out of bed, and I tried to shift out of bed, and I was like, I can't get up.
Wow.
That was the key. That's like, okay.
That was the day.
My wife said, go take care of that. And it was the right thing to do.
That's amazing. That's incredible. To your point, one of our physical therapy experts who we consult with often here in the foundation says that there have been studies done where if you take an average person off the street, 80% of the time, people are going to have disc disease in an x-ray. If you just pull a person off, randomly off the street, 80% of the time, you're going to randomly see on an x-ray disc disease, but it's not symptomatic. And so what do you do with that? Nothing. You don't do anything, right? There's
right.
It's not bothering you. It's not causing a problem. It's just what it is.
Well, I remember when my x-ray came back, I was shocked, because I was like, well, I was looking at it, I go, that's me? And I saw there was a 20% scoliosis that I had no idea. Someone told me, actually my colleague said he saw me walking down the hallway one day with some clothes on, and he goes, you're crooked. I am. I don't feel crooked. And so when the x-rays came back, 20% scoliosis, I was 59, I guess, at the time. I was like, that's not right.
Wow.
So that really kind of shocked me as a physician. Like, boy, that's a big problem. So that's when I really had to put the heat on.
Yeah, been compensating. And of course, we all have some degree there are the normal curvatures of the spine, and we all have some degree of scoliosis or a little turn. But when it gets to that point, it is weird. And I felt the same thing when I saw my x-ray and I said, my leg's hurting. Why is there a problem in my back? I just didn't,
Right.
like, why are you taking an x-ray of my back? I'm telling you, it's my leg.
Sure.
So, and I looked at that x-ray and I said, oh my God, is that me? What's that vertebrae doing way over there?
It shouldn't be like that.
Shouldn't be there. So that's so interesting. Well, Michael, we know that spinal healthcare is a journey. I'm so thrilled that you're back to your favorite activities. We know also that spinal healthcare is not a one and done situation, right? So you get the awareness, you find the diagnosis, you get the right treatment, you have your surgery, and now you're back in life. But there is an ongoing maintenance component of that, right? So talk to us about what things you are doing, or what kinds of things you think about or you do to prevent, further injury or to maintain your great success.
Well, first was patience. I'm not typically a real patient person when it comes to physical things. And so I had to realize that, okay, let's follow the plan and let's do what my doctor and my therapist have told me to do in order to recover from the surgical procedure first. Because that does take some time. And I think my physician told me it'd be about 6 months for the fusion to really be solid. So I had to be very careful those first 6 months. I got involved a physical therapist, and they were great. They did so many different unique types of therapies to help stabilize, particularly my area that was involved. So I stuck with that. I went to therapy twice a week. I was really diligent about that. Once I finished therapy, then I went to a local facility here in Manassas that is a health facility sort of thing. It's tied with George Mason University. And they have an excellent program there. They've done spine work worked with spine folks before, and did some really unique types of strengthening core exercises that I had never even heard of, which was really, really cool.
Wow.
And so I stuck with that for the next 3 months. And then once I felt, and I went back to my doctor and he said, hey, you're good to go. You can go ahead and start doing things. That's when I really poured myself back into the Pilates and the yoga sort of thing that's helped me the most. I like the mind-body connection. I think that's very important in recovery of things like this. And so that's where the yoga helps. So my wife and I do yoga, try to do it 2 or 3 times a week.
It's great.
And then being very careful. I have a big yard at home, and I really like to work in the yard. And I can't do a lot of things I used to do before because it's just too much on my spine. So I'm slowly getting back to some things, but just being careful as I do things. I mean, how to pick things up. I mean, it sounds so silly. You just can't snap over and pick right back up. You got to do things differently. And so it takes time to relearn that.
And thoughtful movement, right? You've got to really think about the movement.
Yes. Think what you're doing. Don't just snap at something. Think about, how am I going to do this? It pays off because your back, you have one spine and you have all these muscles around it. And your spine, if there's a problem there, then you have to do everything else around that spine to maintain your posture, your form, and everything. So it really is so crucial, that whole core mechanism. And I really appreciate now more than ever how important that is.
Yeah. What's amazing with the advancements in minimally invasive surgery, the surgeons can make these tiny incisions and really not disrupt the muscle tissue, around the spine. And that really does aid in faster recovery and getting back quicker. And just the more that you can do to be healthy and strong in that way, the better all of that goes. So I just feel like you're just really an inspiration and a role model for how to get through this. Really just amazing.
Well, I was happy that my surgeon decided to go from a lateral approach, because he said it'll allow me to get back to my types of things I like to do sooner. It was weird because when they go through the side to get down to that spot, they have to go and they push the tissue aside and they push on the femoral nerve in that particular type of procedure. And so I still have some numbness down into my thigh, which is a little odd, but it's going away slowly over time. But he told me to expect that. But never did I have really any problems with functioning. So it's just all just learning how to deal with that unusual symptom. But I was so glad he went in that direction so that I could get back a little sooner to the things I like to do.
Well, that's awesome. And as I'm looking at you on this recording. Of course, our listeners will be listening, but I'm seeing you in front of me, and you just look awesome.
Thank you.
And it's been a year, and it's just amazing. You look just so healthy and vibrant and happy and fit and all those wonderful things. Yeah.
Thank you. Yeah, I did. And getting back to playing golf, that was my real added benefit. Never thought I was going to be able to swing a golf club again.
Yeah. Oh, that's a miracle. Honestly, we say miracles of modern medicine, and what a great time to be alive in this time that we're living in. It's amazing.
Yeah.
And just kind of last thing, you're sharing on the recovery side, being really committed to your physical therapy, really doing what it takes. Was it hard to carve out time to do that with your job? How does that play out? What could people expect when they're trying to, get to those appointments, also trying to get back to work? What does that picture look like?
So my plan was typically go in 2 times a week to physical therapy for 45 minutes, maybe an hour. Just depends upon what needed to be done at that time, because they reassess you as you come in to see how you're doing, how you're progressing, figure out the plan and the program. So that's an important thing, is that you have a good therapist who is willing to work with your surgeon and help to guide these sort of things. And so luckily I had that. So I would try to make time, either sometimes it would be before work, sometimes at lunch, sometimes after work. The nice thing about therapists, they have lots of hours that are unique, and even on weekends sometimes. So it's just finding that time and committing to it, because I didn't really have to take time off for therapy. I took time off from after surgery for 3 to 4 weeks, which was difficult, but I had to do it. I just had to recover. But then once the therapy kicked in, I almost looked forward to going to it, because I could tell, hey, I'm getting better. I can see the improvement I'm having. So it's just fine. Just making the time, just like anything else that's important in your life.
That's awesome. That's so good to hear. And it is almost like something you look forward to, because you're starting to feel so good each time. And you want that feeling. That's awesome.
When you start to accomplish things, like, all right, I've met these goals. Where are we going now?
Going surfing.
Yeah. Haven't tried that yet.
No, okay.
I hope to try surfing next New Year's, I guess, is the time we're thinking about going back. And I'll give it a try. We'll see how it goes.
All right. Awesome. Well, just sharing in my story, I grew up a skier. I think I got my spondy in a ski fall. And so I just figured I was probably never going to downhill ski again. No. And had my fusion, end of 2017. And I went downhill skiing this winter. I mean, it took me a few years to, get ready for that.
What a thrill.
I was like, wait a second, I forgot how hard it is just to get the boots on. But I did that. I popped on the skis and I got on the lift, and I took it easy. I didn't do it the way I used to do it, which is fine, but it was just incredible. And it was awesome. So you'll get back on that surfboard, and you'll be like,
yes, ma'am.
I never thought I'd do this again. Here I am doing it.
Here I am.
What part of the world do you like to surf in? Where do you guys go?
We go down, I guess my wife, about 2015, I think the last time we went, or first time we went. And it was, she wanted to go on a women's surfing trip, but then she goes, well, why don't you come along? They had a co-ed thing. And so we went to Costa Rica on the West Coast.
Nice.
The most beautiful waves, really great sets, beautiful people. Oh,
yeah. Home of the endless summer, right? That whole thing over there. Tamarindo, Devil's Rock over there in Costa Rica.
Yep.
Awesome. That's awesome.
It is an awesome place. Yeah, if you get a chance to go. go.
Yeah, I've been there. That's awesome.
Good.
Well, Dr. Perez, Michael, it's been an honor to meet you and step into your story. I think there's something so powerful about you as a physician, being able to share this true empathy with your own neck and back story with your patients. And we are so happy that you're going to get back to surfing, that you're golfing, you're doing your yoga. And I thank you so much for inspiring other people with your story. And I will part today's conversation with a namaste.
Namaste. Thanks for having me on. Thank you very much. Enjoyed sharing.
At the National Spine Health Foundation, something we believe in most is providing hope for recovery through sharing stories of success and expertise. It isn't always easy to find someone to relate to, even though 100 million adults suffer from neck or low back pain every year. To hear more stories of spinal champion recovery and success, access educational materials about spine health, visit us at spinehealth.org. If you're interested in supporting our show financially, you can contribute at the link provided. Thank you for listening.